Hello nurses, this is Kevin with Nursing KAMP.com, and these are my scribble notes on nursing in the NCLEX. Today's focus is going to be on this sticky note, renal toxic meds. I can be found on Instagram, Facebook, Pinterest, and Etsy, and nursingkamp.com, where you can find this sticky note. The mnemonic we're covering is no contrast cake man. All medications that cause renal toxicity. And we monitor the creation, which is create the world in 7 days. Creatinine, 0.7 to 1.4. That's how I remember it. And 1.4, if it's greater than 1.4, the kidney's affected because the creatinine is inside the kidney. That's not really a kidney, but and that's from this BMP in these two labs, the BUN and creatinine. If both of these are elevated, we go down to the GFR, and hopefully that's greater than 60, but if it's less than 60, the kidneys are affected, and there's something wrong with them, and kidney damage. And it is either chronic or acute. So the BUN and creatinine are the creatinine labs for renal toxicity. Okay, let's go. The first thing is contrast. So no contrast with these medications, because when you're given this contrast and these medications together, they need to get out of the kidneys through ureters and out. And if we do not, if we give both of them at the same time, the body can't really differentiate between the two, and it's going to overtax the kidneys, and therefore the creatinine and BUN will elevate and become renal toxicity. So no contrast with these medications. And we monitor renal function when we're giving contrast. That's why we increase fluids after. And we don't hold or make them MPO after contrast. So let's get into the meds. Cyclosporins is the C. ACE inhibitors like lisinopril and captopril. So in the distal loop. Please see my ACE inhibitor lecture. It's interesting because on renal patients, they often receive ACE inhibitors, which is contrary because it also causes renal problems. It's just interesting to note. Keppra, anti-seizure med. Also level meds like Dilan 10, TEN 10. It's part of the 10-20 club. It's also liver toxic. But we're talking about renal and BUN and creatinine. Then erythromycin and vancomycin. And vancomycin is also part of the 10-20 club. Level greater than 20, BUN, creatinine, elevate. Also metformin. And metformin is interesting because metformin is held before and after. And anywhere from 24 to 48 hours, follow agency policy. Because of if it is given, BUN and creatinine will elevate. Next is Amphotericin, which I like to call amphoterrible, and then Nsaids. And Nsaids like Motrin, Advil, and it's also liver toxic. The magic number is 3,000. Also, I've seen 3,200, but 3,000 seems to be the most likely. Remember that Motrin is also liver toxic, so that's why there's a limit on how much you should be taking. As well as Tylenol is liver toxic, and Tylenol is 4,000 milligrams, but Tylenol is not affected by the kidneys. Next is sulfonamides, sulfamethoxazole. And those are the cake man medications, all medications that can affect the BUN and creatinine. And if they're elevated, we generally will question these medications, but if we give them and we see elevations, they could be renal toxic. And we never generally give those medications with contrast. Well, my name is Camp, and this is Nursing Camp, and you can find me on Instagram, Facebook, Pinterest, and Etsy. Also on nursingkamp.com, where you can download this sticky note, and we'll see you next time. Say hello, nurse on.